ATOS Origin, who own KPMG Consulting, do medical assessments on disabled people. A thing called the Work Capability Assessment. ATOS have found there's a place down the road there at Cadogan Street in Glasgow where they do these assessments that's become nicknamed in Glasgow Lourdes, because people who go in there magically get well. They found a whopping 68% of disabled claimants fit for work, but when those disabled claimants appeal to tribunal, more than 40% are successful in repealing ATOS's decision. The figure climbs to 70% if claimants get legal advice. If that was going on in the criminal justice system, I'm sure there would be riots in the streets. ATOS have found people with terminal cancer, Parkinson's disease, schizophrenia and multiple sclerosis able to start looking for work. This company, ATOS Origin, so-called Healthcare Limited, killed. ATOS killed. There have been several suicides among disabled claimants. One such suicide was the writer Paul Reekie of Edinburgh, who took his life last year after undergoing a work capability assessment. He was a contemporary of Irving Welsh. The Black Triangle campaign was started after Paul took his life. People with severe mental and physical impairments are being bullied and humiliated into finding minimum wage jobs that aren't even there. The last Labour government replaced incapacity benefit with employment and support allowance and introduced a harsh new medical test to hack back the number of qualifying claimants. It appointed ATOS, a French IT company, to carry out these so-called medical assessments. The condemned government has enthusiastically pushed forward Labour's attack on the sick and disabled and is paying ATOS £500 million for a seven-year contract. Meanwhile, a convenient media campaign to con the general public into believing that the benefit system is full of scroungers has been stoked up as pilot schemes at Aberdeen and Burnley magically found 70% of ESA claimants fit for work. These schemes are now being rolled out nationwide. 12,000 sick and disabled people per week are being assessed under these. I mean, this is an affront to humanity. This is human rights being breached day by day, right under our noses, in our towns and cities, up and down the entire length and breadth of the United Kingdom. So many claimants are failing assessments because the ATOS computer test is so stringent and mismanaged that seriously ill people are regularly being declared fit for work. The Citizens Advice Bureau Chief Executive has written that seriously ill and disabled people are being severely let down by the crude approach, while in February, the Glasgow Herald newspaper reported the deaths of 2 sick claimants waiting for their appeals against the loss of benefits due to their being fit for work. And ladies and gentlemen, these people have not only lost their benefits, waited 10 months to go to appeal, one at the tribunal service, then were called back, lost their benefit again, then won at appeal, then it happened again. This is terrorism of disabled people. This is being done in the name of all you shoppers out here today. It's high time everybody woke up and stood full square with the disabled of this country, because you could become disabled at any time. Any one of us could. Any one of your family, your wife, your brother, your loved ones. ATOS routinely ignores the evidence and opinions of doctors, consultants and psychiatrists, while their own doctors and nurses, who sit ticking boxes on a computer as they follow a rigid, inflexible series of questions, are incentivized to find people work. Yes, ladies and gentlemen, they have a target and they get bonuses for keeping it. Human beings seen as nothing but profit and loss on a balance sheet. Concern at the role of the ATOS doctors has been expressed in the British Medical Journal. The Royal College of Nursing has refused to accredit their nurses' training. These doctors and ATOS get paid even though they are clearly wrong. We reject absolutely the state's claim that those who didn't appeal are somehow accepting they didn't deserve their incapacity benefit. The truth is that many of these claimants are, by the nature of their illnesses and incapacities, their disabilities, lacking the resources, the confidence, articulateness, motivation, energy and awareness that they need to mount a successful appeal. Appealing depends on some level of understanding of what procedures are available and how to access them. And we all know that the benefit system is deliberately complex. You need to be an absolute expert to be able to navigate your way through it. These assessments have nothing to do with the sympathetic care and support of the sick and needy that should be the mark of a civilized society, and have everything to do with the ideological attack on our country's people, encouraging a changing thinking to that of the past, and in particular of the Victorian poor laws, making the vulnerable pay for a crisis that was none of their making. The process is being driven purely by targets to slash welfare spending. Citizens Advice Scotland, in a 2010 report, wrote, "Our evidence has highlighted the cases of many clients with serious health conditions who have been found fit for work, including those with Parkinson's, MS, terminal cancer, bipolar disorder, heart failure, strokes, severe depression and agoraphobia." Meanwhile, Britain's wealthy, the bosses of companies like Vodafone, Sir Philip Green and Topshop, whose wife lives in Monaco, the bankers whose greed triggered this crisis, the people on Wall Street who securitized bad mortgages that were missold to poor people, they rake in profits and bonuses. Their wealth has gone up by 25% since the beginning of this crisis. And while the state and its friends in the media demonise poverty-stricken claimants as fraudsters, it allows billionaire big business to avoid and evade tax on a massive scale. Ladies and gentlemen, I ask you to wake up and realise that this condemned government is raping our society. It's undermining all the ideals that we hold dear. I'm here today to speak in solidarity with my comrades here and all of the people on strike at PCS. An attack on their fight is our fight. An attack on their pensions, an attack on us, it's an attack on you. Whether you work in the public sector or the private sector, you need to stand together, because if you don't stand together, in 4 years' time, there'll be nothing left of our society as we know it. And God help you if you fall ill, God help you if you become disabled, and God help your children if they grow up in a world like that. Thank you very much.